Bromfenac Sodium Drops are used to reduce swelling and pain in the eye following cataract surgery. This medication is part of a group of drugs called nonsteroidal anti-inflammatory drugs, NSAIDs, which work by blocking the effects of certain natural substances in the body that cause pain and inflammation. It is important to use this medication as prescribed by your doctor to ensure the best results. The typical dosage is 1 drop in the affected eyes once daily, starting the day before surgery and continuing for the following 2 weeks. It is best to take the drops at the same time each day to maintain consistent levels of the medication in your eye. Before using Bromfenac, make sure to read the instructions provided by your pharmacist. Your doctor may instruct you to start using this medication before or after your surgery. Typically, you will need to use 1 drop in the affected eye once or twice a day for 2 weeks. Be sure to follow your doctor's specific directions. To apply the eye drops, wash your hands first and be careful not to let the dropper tip touch your eye or any surface. Remove contact lenses before using the drops and tilt your head back while looking upward. Pull down the lower eyelid, place the drop in the pouch, and close your eyes for 1 to 2 minutes. Gently apply pressure near the nose to prevent the medication from draining out. Do not rinse the dropper and replace the cap after each use. If you are using other eye medications, wait 5 to 10 minutes before applying them. Use the eye drops at the same time each day and continue using it for the full time prescribed. Do not use the medication more often or for longer than directed, as it may increase the risk of serious side effects. When using Bromfenac Sodium Drops, you may experience temporary irritation, burning, stinging, or blurred vision in your eyes. This could also cause watery eyes or a headache. If any of these effects persist or worsen, be sure to inform your doctor or pharmacist. Keep in mind that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to seek immediate medical attention if you experience severe pain or redness in the eye, sensitivity to light, eye discharge, abnormal vision, the sensation of something in your eye, or itching, redness, or pain around the eyes. A severe allergic reaction to this drug is rare, but if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing, seek medical help right away. If you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist for further guidance. Before using Bromfenac Sodium Drops, it's important to let your doctor or pharmacist know if you have any allergies to this medication or other similar medications. This product may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Before using this medication, it's important to inform your doctor or pharmacist about your medical history, especially if you have asthma, bleeding disorders, other eye problems, diabetes, rheumatoid arthritis, or growths in the nose. After using this medication, your vision may become temporarily blurred. It's important to avoid activities that require clear vision until your vision has improved. Before having surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding, as it is unknown if this drug passes into breast milk. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. Some products that may interact with Bromfenac Sodium Drops include antiplatelet medications, such as clopidogrel, other NSAID medications, such as aspirin, ibuprofen, and blood thinners, such as warfarin, heparin. If your doctor has advised you to take low doses of aspirin to prevent heart attack or stroke, typically 81 to 162 mg a day, it's important to continue taking the aspirin. Remember to consult your doctor or pharmacist for more details. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 or a poison control center immediately. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. This medication is used to treat swelling and pain in the eye after cataract surgery. It is also used to relieve eye itching caused by seasonal allergies. Bromfenac belongs to a class of drugs known as nonsteroidal anti-inflammatory drugs, NSAIDs. It works by blocking certain natural substances in your body to reduce swelling. If you forget to use a dose, use it as soon as you remember. If it's almost time for your next dose, skip the missed dose and use your next dose at the regular time. Do not take a double dose to make up for the missed one. When it comes to storing Bromfenac Sodium Drops, it's important to keep them at room temperature and out of reach of children and pets. It's also crucial to dispose of the product properly when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Remember not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.